Hello, everyone. My name is Sujay Hajela, and I'm the Senior Vice President and General Manager at Juniper Networks. And joining me today is a special guest, Chris Parawate, Chief Information Officer at Northeast Georgia Health System. Chris, welcome and thank you for joining us today.
Thank you, Sajai. Glad I could join. Really excited to talk today.
Awesome. So, Chris, tell us a bit about Northeast Georgia Health System and your role there.
Sure. Northeast Georgia system, just as the title says, is the health system for the northeast quadrant of the state of Georgia. We have four hospitals and over 120 care locations, which represents roughly $1.6 billion in gross revenue. And for IT, I'm responsible for everything IT, and that includes 304 staff and 16,000 users.
Wow, that is impressive. And Chris, of course, we thank you and your team and the system to do what it does, especially more, amplified in the unfortunate pandemic we all are navigating with today. But I'm sure, like other healthcare providers, COVID presented a number of challenges for you and your team. Could you, if you don't mind, speak a bit about how you and your team met these challenges and how your network helped you approach these challenges?
Yeah. So first of all, we are in a very good posture for COVID. While a lot of IT organizations went remote, our IT system actually got more on site. We completed over 134 projects, everything from setting up pandemic virtual triage tents in each of our facilities, standing up additional units. We actually moved a state-sponsored mobile COVID unit, inpatient unit, all of that riding on our Juniper network, all of it on top of our Mist wireless. We expanded our users, the devices our users are leveraging, as well as medical devices, and we had the scale and the capability to respond, not only to our facility, but to other facilities in our community. Some of our for-profit indigent care sites, we were able to stand up with our electronic medical record, leveraging our Juniper network to facilitate that care. So really proud of the response that we've had to COVID, and I'm happy to see the numbers coming down.
We all are, and we all are eagerly awaiting to see when our whole country and frankly the globe is able to not only get the vaccines distributed, but of course inoculated. Chris, we've been speaking about this quite a bit, and as we deal with what I call the new norm, I also am aware of just the strong viewpoint on technology and how it can aid the Northeast Georgia Health System that you're involved in.
Yeah.
May I request you to share how you are bringing transformation in driving these outcomes in IT? And if you don't mind, I'd also like you to speak a bit about your mobility strategy.
Yeah. So, Sajai, IT has the ability, a single employee in IT can touch more patients than a physician can touch in a lifetime. The technology that we're implementing not only saves lives, it also provides safety for our employees and all of our clinicians. It's so vitally important. One of the things that we work on right now is our mobility strategy. And at the fundamental, it's communication. How do our providers and our clinicians communicate effectively about what's going on in our patients timely? So on top of our Mist network, we are implementing a mobility device that is both bring your own as well as a physical device. We're converging that with an alerting system, a phone directory, and an application delivery mobile device management solution. And what that will enable, if I could just picture that, you could picture that for a moment, is that a physician would be walking in from the parking lot. We would recognize and geolocate that provider as now in the building. We would send that individual a message. They would log in using their credentials, which would be a badge. When they do, that phone would automatically be provisioned into the network, given wireless priority, download applications, add them into the phone directory, tie them to their patients, and alert them about what's going on. It also enables the nursing staff and the clinical staff to see that that provider is now in the building and is responsible for these patients. And they can simply say, yes, let me have the physician for Dr. Smith, patient Smith, and it'll automatically connect that physician. And when that physician leaves the building, we also deprovision that device, deprovision it clinically, and then work for the next assignment. So it's incredibly innovative, and it's converging several technologies. But at the base of that technology is our Mist solution. And as you think about that communication, it has to be built on a stable platform that's dynamic, that can work through the challenges of an aging hospital system that has bolted on buildings and configured different components. And we find that the Mist solution is leveraging a lot of the same things we're doing in the clinical domain, leveraging AI, simplifying the technology stack so that we can deliver that solution and do it in a very cohesive way.
Chris, that is definitely inspirational. So if I was to, paraphrase for my own understanding, first of all, you are solving a big problem about the persona of the device, right? None of us want two devices, in our hands all the time. One, for some stuff, and second, which is work related. By bringing the confluence of these two personas into one based on where you are, that is definitely exciting. And I would request you to also speak to our CIO at Juniper, Sharon Mandel, about that.
Absolutely.
But coming back, what I really like when as you were sharing your mobility strategy and gave us an example of how you are really simplifying the lives of, the staff at your hospital, you also mentioned making it simple. You mentioned leveraging AI to enable your mobility strategy. And as you know, Chris, when you and I started talking, it was exciting to see that common vision of client to cloud. What I even like more was when we spoke about AI, you were very clear about it is an enabler. It is an enabler in simplifying the operations of the network. Could you please share how we at Juniper can support you further in transforming the enterprise as you bring this vision to Northeast Georgia Health System?
Sure, Sajai. You can tell I'm super excited about this. And it speaks to where technology is changing in healthcare. As I shared, we have 300 people in the IT division. They're terrific people. I have amazing staff. But more and more, technology is embedded in the business operations, and the technical solutions changes our care delivery. A year ago, we didn't do video visits. Today, we do them all day long. It's on people's schedules. They connect. It's one click. It's simple. It's a good experience for our patients and our clinicians. It's the same thing in our technology. Many, many years ago, Sajai, when you and I worked, right, on technology, we had to know programming languages. We needed to know technical protocols. Things didn't plug in and play and work, right? But it took an army of people to support that with an incredible amount of intelligence and skills and technology. As you flatten and make that experience easier through AI, through that cloud delivery, instead of having an army of very advanced network engineers and partners that I need in order to run that operations, I'm able to run it with a team that is then able to focus on more advanced things. And I couldn't do the mobility solution as an example if I had all my engineers focused on just configuring networks and wireless solutions and controllers. And so that using that AI, using that cloud hosted solution allows me to allocate those resources in more productive ways and simply be more responsive to the business.
Thank you, Chris. It's about the responsiveness to the business. So, Chris, I hear you were recently named by College for Healthcare Information Management Executives, CHIME, as one of the nation's most wired hospitals. Well, I would add wired/Wi-Fi, but I understand the wired hospital. And the only hospital in Georgia to receive level 9 certification. That is just amazing recognition for the transformation you're bringing to the Northeast Georgia health system. Could you speak to what this means to you?
Yeah. So the chime recognition of Most Wired is not anything like what you described. It is a measure of the adoption of technology into our healthcare practice. And so what I would tell you is it's an award for the health system in its adoption of technology. It's not, it means nothing to stand up hardware in data centers. It means nothing to provide technical solutions unless they're fully adopted into the operations. In order to do that, you have to provide solutions that are simple and easy to adopt, make the organization more nimble, take away the things that are a hassle in our everyday lives so that people can focus on the most important work. And so the HIM Stage 7 survey is a representation of that. We've got more work to do. I want to be 10, I want to be 11, I want to be 12. But most importantly, and as you get back to the core of everything that we do, the ability to take care of patients and be responsive and to provide an extraordinary experience in whatever phase of life individuals are is the core of what our mission is. And we cannot do that without technology.
Chris, really an inspiring conversation. And level 9 certification is no mean feat. You know that, and I know that. So definitely, would love to partner with you as you extend those certifications to higher levels. It's always exciting, when I speak with you, and the mobility strategy was quite exciting. I also feel that the insights you shared today definitely would be of help to your peers in the industry, as all of us are trying to understand how we can leverage technology to drive outcomes. Thank you, Chris. We appreciate you joining us today and sharing your insights.
Thank you, Sajai. Good to talk to you again.